السلام
Islam.
ورحمة الله وبركاته.
Can you see my slides?
Yes, yes, sir.
Okay.
Yes, Dada.
بسم الله الرحمن الرحيم، أفضل الصلاة وأتم التسليم على سيدنا محمد وعلى آله وصحبه أجمعين. اللهم علمنا ما ينفعنا وانفعنا بما علمتنا وزدنا علما متقبلا يا أرحم الراحمين. رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني. So, Assalamu alaikum and good morning, everyone. So, for this time, inshallah, I will cover two main components of research in general and specifically in writing research proposal, which are the statement, the problem statement and objectives in research. First, let's introduce myself. I am Dr. Eid from Faculty of Pharmacy. I am Quantum. I have PhD in pharmacy practice. So, as I am from medical background, so most of my example will be from also medical study. As most or all of the participants here are from the Quantum campus, so I believe also they are from science and also medical background. So, inshallah, we are on the same page. So, let's start first about the flowchart of any research or designing a research. At the beginning, as all of us will do, we will do a literature review. But however, before literature review, of course, we need to have something in our mind. So this in our minds, what the idea in our mind usually is either based on reading or sometimes on observation. So let's say, for example, you are serving in any pharmacy or clinic, and you notice that, for example, the waiting time to see the doctor in your clinic is about, let's say, the main is about 2 hours. So you are wondering whether this will be considered as a long waiting time. And also you keep thinking whether this will affect your patient's intention to come again to your clinic or to see the doctor or even to be treated and subsequently to take their medications. So this trigger will let you go and do kind of literature review. Based on this literature review, you will identify the knowledge gap. So if you find in the literature what is, for example, the main waiting time for the patients to see the doctor around the globe, for example. So now you have the knowledge about that. If you find the factors that contribute to this waiting time, also you have the knowledge. But let's say that there is a specific part which is not yet studied, which is, for example, the perception of these people about the waiting time and how can this affect their accessibility to the healthcare facilities and also their intention to continue their treatments. So now you find that based on the literature and again before the literature based on your observation, you thought that the waiting time is a problematic issue for patients. Because of that, again, you did a literature review and identify the knowledge gap. Based on that, you will define the research question. In this example, let's say the question will be for the research question. Usually, it's a general question, not specific. Although some scholar can divide the research question into the general question and also specific question. Specific question will be answered by the objectives, but the general one is will be answered by the main goal of the research. For the research question in this case, so let's say, what is the perception of the patients about their waiting time at our outpatient clinics? So this is your research question. Based on that, you would write the problem statement, and from problem statement, you will come out with your research objectives. So in this, I'm not sure whether this will take, I know the scheduled time is 2 hours, but I don't think this will take 2 hours to cover these 2 points, which is the problem statement and the research objectives. So if you go to problem statements, if you need to divide this into two words, which is the problem and also the statement. So by rights, you know your research problem, what the problems you are going to investigate. The statements, you need to state your problem in sentences. So if we want an academic definition for the problem statement, we can say it's a concise description of either the issue, whether you have problems you need to solve, or the challenge related to any type of research, or the knowledge gap that your research aim to address. So number one, it should be concise. So for any readers, your problem statement should be concise, shouldn't be very lengthy, and it should be also should focus on your research problem. And we will see in details why it's important to conduct a research that can address this problem. So again, the definition is a concise description of the issue. If you are during your work, for example, you are facing any issue, any problems, and you would like to answer the question why this problem is happening or how to solve this problem, all this can be considered as a background for any research that could be conducted to solve this issue, or at least to fill in the knowledge gap if there is any. So the basics or the essence of problem statements. You need to think about your problem statement as the compass that will guide you in your research journey, especially at the beginning when you start your research journey. Because uh, for any problem or any issue, there are usually several angles by which you can see the problem. There are different aspects. You can see any problem from humanistic perspective, from economic perspective, from clinical perspective. So it depends. So you need to be specific. So this will guide you, will serve as the compass that guide you as a researcher through this usually a complex view, a complex picture for your investigation. So you will know exactly what are you looking for. It shouldn't be broad, shouldn't be vague, it should be very specific. So in your research, in your problem statement, it articulate the research problem. Like saying, for example, the example we just mentioned about the waiting time. So you would write one or two sentences about the waiting time. Like research found that the average waiting time to see the doctor is 2 hours. And this affects the patients, let's say, quality of life or affect their uh, 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 willingness and also readiness to receive the treatments. This increased, for example, their anxiety or whatever. So this is your research problem. Then justifying its existence. It's here referring to the research. So you justify why it's important to conduct your research. And again, it asserting its relevance. Relevance to what? Relevance to the context you provide at the beginning. So of course, you will start with the background, usually introduction in your proposal. So your problem statement should be aligned with the context, the background you give to your audience, to your readers. So that problem in the problem statement, you will put the research problem and you will justify the research you are going to conduct. Also, a well-crafted problem statement will not only depict the gap in the current knowledge, but also it will highlight, it will emphasize, it will underscore the significance of addressing it. Because as the waiting time is a problem and they may affect their intention to come again to the clinic, so this will affect the patient's condition, the control of their condition. If they're having chronic diseases, this will affect their chronic disease control. And subsequently, this will affect their life, increase hospitalization, for example, increase the cost, and their well-being by reduce the quality of life. So all these problems should be understood by any readers who will read your introduction and then your problem statement. So you will mention the problems, the problem of your research, why it's important to conduct, and you may also add what is the consequences of not resolving this problem. Okay. Please, if you have any question, just interrupt me. Don't wait until the break or the end of this lecture. Okay? Because I can't see the video of any of you, and also I cannot even see my video, so I'm just seeing my slides, so I'm talking to myself. So please, if you have any issue, let me know, okay?
Okay, Doctor.
Okay. So when you write a problem statement, and based on my actually observation for the students, um, let's say at least half of the students, I believe they have a problem in writing a good problem statements because they don't understand what is the problem statements. Usually they include it in the introduction, but there is no specific paragraph which is for problem statement. So what are the components? What are the elements that identify a strong problem statements in terms of writing a problem statements? How should you write it? As I mentioned at the beginning, you need to provide a contextual background. You will, let's stick to the same example. So about the waiting time to see the doctor, you will provide again about some statistics, trends, facts about the how the waiting time could affect the patient's perception about the treatment, the healthcare settings, and everything. And you will contextualize the issue within the large field of study. If you are focusing, for example, about on specific population of the patient, saying the older adults, people who are above 60 years old. So you'll start with introduction about why this population consider as a special population. And then after that, you may consider uh, 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 state the problem about the waiting time and how this waiting time, the impact of this waiting time could be different in older adults compared with other population. Like older adults, usually they need, for example, to go to toilet frequently. So this will maybe annoying for them for long waiting time. Standing for sitting, for example, for a long time, also may increase their back pain and also other chronic pain. So this is how you need to introduce to your problem statement. So this is an introduction. When I read your introduction, I can uh, just expect what are you going to say in your problem statement. Then after that, you need to clearly articulate the gap or deficiency in the existing body of knowledge. So some of the students, they will, yes, they will write about the problem, about the waiting time, and how this, to what extent this is will be bad for the patient and even for the business running by the clinics, etc. But they will not say what is the gap. So if all this information is known based on the literature, so what are you going to do, right? If all this information, we know that for example, the prevalence, the average waiting time, the impact of waiting time, the perception of this patient about waiting time, and also the opinion of the practitioners about this waiting time, the impact on long term impact on their health and also quality of life. If all these questions have been answered, so what are you going to do now? That's why you need to clearly identify what is missing. It's like a puzzle. So there is one stick or one piece, or depends on the actually whether you are in master or PhD level. So how many pieces you need to find in order to give the reader the full picture about this problem. Also, specificity, you need to be very specific about your problem, okay? If you are trying to find an issue related to antibiotic resistance, for example, you need to be very specific about whether you are going to check for the resistance in any specific population, in any specific area, and also this will later tell the readers about your objectives, about the goal of your study. And last but not least also is the scope of your research. You need to frame the problem statement in a way that will allow for the reader to know what you are focusing on. So you define the boundaries. For example, you need to be very clear that we are going to do a research related, for example, to water contamination in Quantan area and how this could affect the people who use the drinking water from the river and what are the problem associated with it. So this is the boundaries. This is the limitation of your study. You are not going to involve the entire Malaysia. You are specific on this area. And also, if you want to be more specific about a specific population, like children, older adults, etc., it depends again on the goal of your study. So let's take some examples related to, okay. So we may have a question from Noor Haslina. Yes, sister.
Assalamualaikum, Dr.
Salam.
Muhammad Akkawi.
Assalam.
Okay, I just want to ask regarding the frame problem statement, which is
Mm.
I do action research that I want to implement early warning scoring system in my hospital, my state area in Malacca. Then
Oh,
there is a many problem among nurses to do the vital sign hourly in medical ward. So
okay.
I just suggest to implement this EWS scoring to improve our quality of nursing care, to detect early deteriorating condition of patient.
Okay.
However, the problem statement here, that gap identification that I just confused, which is means to improve nursing quality or healthcare assistant, medical officer, and the policy to be
Yeah.
develop local policy for our hospital. Which one I think may more important?
Actually, this the one who will answer the question which one is more important. Actually, the researcher, of course, which mean involving the students and also the supervisor. But you need to be very specific. Whether your aim is to develop a new policy for your hospital, or
Uh,
you need to come out with any like intervention guide of intervention or assistant to the nurse staff that can make it more efficiently or easily.
okay.
Okay.
Thank you.
We will go in details more about the problem statement and the objectives. And in the second, inshallah, session, I will ask you to present your problem statement and objectives to discuss. Okay? So we will have time for that, inshallah. Okay? So we will back to the some few examples related to statements. Okay, why it's not moving? Okay. So I provided here three examples, fictional example. I mean, not taking from any research. So number one is mental health is important for overall well-being of all communities. So here we have a specific area of research, which is the mental health. And I claim in in these problem statements that mental health is important. Okay, we all agree on that for the well-being of all communities. So, is it a clear problem statement? What do you think? Okay, speak up, please. Let's hear from you. What do you think about this one?
The number one, mental health is important for overall well-being of all communities.
Yeah.
This is not a very good problem statement, I think.
Okay. So, in terms of having a problem statement, yes. But actually, in terms of the quality, we are not, we don't know what this research going to address. What is the specific problem related to mental health? What is the population that is targeted? And what are we going to investigate? So the problem with this problem statement that it's too general, is very broad. If we read the other two, the contaminated water leads to several diseases among children. So here we have a specific population, which is children, and we are talking about also a defined disease, that disease related to water contamination. Still, this is vague because we are not sure what are the researchers going to do related to this one? What are they going to assess? And what is the target of their research? Last one, diabetes. DM is a common chronic disease affecting millions of people worldwide, leading to multiple complications. The same also, if we say that the problem statement should be like a compass that guide you about what is the angle you are going to see the problem or the research. In this one also, we all agree that diabetes is a common chronic disease affecting 4 million of people worldwide, and this leading to multiple comorbidities. So, our complications. So, are we going to assess the complication related to disease? Are we going to assess the prevalence? Are we going to assess the factor associated with this complication or the effectiveness of the treatment? Actually, all these considered as a broad and vague and bad problem statements. We need more specific problem statements. Okay, we'll see how. So I took these three and try to make them a strong and clear problem statements. So let's compare this with the first one. The first one said that the mental health is important for the well-being of all communities. If we read this one, the lack of access to mental health services in rural communities of Malaysia contributes to a growing mental health crisis, with high rates of untreated depression and anxiety disorders leading to significant social and economic burdens, including decreased productivity and increased health care costs. So if we try to break down these problem statements, we will see how this is specific, and the scope is very clear about what the research that will be conducted. So we are not talking about the mental health in general. We have one part, which is the access for the services of mental health. So we are not talking about the effectiveness of the mental health services. What are the benefits that will be gained from those who have these mental health services? No, we are talking about the accessibility of these mental health services. Where exactly? In rural communities of Malaysia. Why? Why it's important to address or to know about this issue? Because these contribute to a growing mental health crisis with high rates of untreated depression and anxiety disorders. So because of inaccessibility to the mental health care services in rural areas in Malaysia, this increased the prevalence of depression and also anxieties. Of course, all of that should be supported by evidence. We have in the literature studies saying that the prevalence increased, prevalence of depression and anxiety is increased in this rural area compared with the urban cities, for example. So, okay, so now what happens if the mental health is not good or if the depression is high and anxiety? So, even if we don't address this issue, what the problem? You can read the next line, leading to significant social and economic burdens. So if we don't treat or if we don't have a solution for this lack of access to mental health, this will increase the burdens, the social and economic burdens, including. So people who are living in this rural area that they have mental issue, but they don't have access to mental health care services, they will have less productivity, and this will increase also the cost. The cost later, of course, will be specified in the objectives, whether from the government perspective or from the patient's perspective, increasing the cost or could be both. So this will be considered a well-crafted problem statement. So I know from the beginning that they are talking about the mental health, and they specify to be about the accessibility to the mental health services, and also they put the target of the research group, which is people living in the rural area in Malaysia. And we justify, again, problem statement will justify why it's important to address this issue, because the increasing prevalence of depression and anxiety lead to lead to reduce of productivity of these patient of this individual. Okay. Next one. So the other one, which we said, the one which is the big and broad, which say about the contaminated water and how this could badly affect the children. Also, we try to improve by the following. So high level of bacterial and chemical contaminants. So I specified two now, bacterial and chemical contaminants. So both of them, bacterial and chemical, in drinking water contribute. So what the issue is to arise in waterborne disease. Okay, so what if this increase? What will be the consequences leading to increased morbidity and mortality rates, particularly among vulnerable population? When we say vulnerable population, special population, talking, for example, about who have immunodeficiency, children, geriatrics, pregnant women, etc. So in the next one, we will specify which one of these population we are going to study. So now, what is the knowledge gap here? Read with me. However, little is known about the prevalence. The prevalence. So now, this is the specific prevalence of waterborne disease in rural area among children in Malaysian area. So sorry, in diseases in among Malaysian children in rural area. Okay, so please fix it. So let me write it in the good way. So prevalence of waterborne among children in rural rural Malaysian areas. Okay. So for any readers, he will understand what are you going to conduct in your research. Okay. Last one, which was about the DM, diabetes mellitus, and it's very common, and also it will lead to many comorbidities or the complications. So if we read this specific problem statement, despite advancement in diabetes management, there remains a lack of adherence to prescribed treatment. So now we are not talking about the accessibility to the medication of diabetes. We are not talking about the effectiveness of this medication. We are not talking about any issue related to the effectiveness of these medications. But we are talking about the adherence of the patient to this medication. So adherence to prescribed, adherence meaning following the instruction by the prescriber to take the medication, for example, every 6 hours or twice daily, etc. All this. This is the adherence to medication. A lack of adherence to prescribed treatment regimen among. So what is my target? What is my target population? Older adults. Any older adults with DM, because we have two types of DM, type 1 and type 2. So here I specify to be type 2 diabetes mellitus, where I am going to conduct my research in urban areas of Malaysia. So not in rural area, but in urban areas of Malaysia. So now, okay, why? What is the knowledge gap? So we'll read the next sentences. Factors associated with this phenomenon were not studied yet in Malaysia. So we know that the adherence is low to the treatment, to the diabetes treatment among older adults in urban area in Malaysia. So this should be at the beginnings. We know this information from the literature review. But what is unknown is why those people are not very adherent to their medications. Okay. Now, what the factors? Is it because of the age? Is it because of the cost? Is it because of the complexity of this regimen? So they cannot handle it. So we will try to find out the reasons behind this phenomenon, which is the non-adherence to medication. Okay, so far so good. I know it's hard to talk during fasting, but at least some reactions, okay?
Yeah, so far so good. Thank you, doctor.
Okay. So we will move now from the problem statements to the research objectives. You will have in your proposal, you will have the same sequence. You will state first the problem, and after that, based on that, from this one, you will have your research objectives. By all means, actually, research objectives is the most important part of your research proposal. Because at the end of the day, you will be asked whether you achieve your objectives or not. So any objectives you write in your proposal, later, while you are defending your proposal, you will be asked how you going to achieve this goal? What is your methodology to achieve this goal? And later on, inshallah, once you finish your research and you sit to defend your thesis, you will be asked, I can see that you state that I'm going to check for the factor associated with non-adherence, but this one is not stated in your thesis, which means that you haven't achieved your goal. And if you haven't achieved your goal, meaning you haven't done your research properly. So how you should think about your research objectives. So like the problem statement will give you the summary, what are you going to do? But the research objectives are like stepping stones that will transform the problem statement into an actionable research plan. So it's like a road map will guide you how to achieve your overarching goal. So the goal is about the adherence of a medication related to diabetes. So, but under this one, of course, you will have several objectives. How many objectives we need to have? Actually, there is no, answer, specific answer. But generally speaking, we say that for example, for master level, so three objectives usually enough. When you are talking about PhD, so usually around five objectives. However, it also depends on the to how in depth you are going to achieve this goal. Sometimes maybe a PhD to achieve one goal, one main goal will be enough. Saying, for example, you will check for prevalence of a specific disease in entire Malaysia. So this, of course, meaning you will analyze the data, for example, of 200 hospitals and millions of patients. So, of course, but under this one, usually will have some, of course, aside or secondary objectives. But generally speaking, this is how many objectives you need to have in your research in general. Okay. What is considered as a good objectives? Objective in your research is exactly like the objectives in your life. It should be, it also can summarize in acronym, which is SMART. I believe almost all of you are familiar with this one. What SMART stands for. S stand for specific. So your objective, every objectives of your research should be specific. So like to evaluate the effectiveness of long-acting insulin among older adults with type 2 diabetes mellitus attending the outpatient clinic of SASMIC. So it's very specific. We know the population, we know the DCs, we know what you are going to measure. So based on that, of course, it should be measurable. If we say, okay, I will check, for example, the happiness of the postgraduate students in Quantum Campus. Okay? How are you going to measure this one? If you have a tool, which is, let's say, name its happiness scale, which is a validated tool, okay, now you have a tool and you can measure the happiness of this population, which is the postgraduate students in Quantum Campus IIM. But if you don't have any tool to measure this, of course, this is invalid objective. So all the time, think about a way to measure your objectives. This could be any kind of measurement, like samples, analysis by taking blood samples or whatever, or sample from the sea to see the contamination in the lab based on the lab work. For example, saying cell culture, DNA extractions, all these you have tools to measure. And for humanistic also studies, usually we have questionnaires, we have tools, we have skill to measure. So every objective should be measurable, and this will be reflected in your methodology, because the sequence of your proposal or your thesis will be introduction, problem statement, and then objectives, and after objectives, you will have the methodology. Methodology should reflect how you are going to achieve your objective. And related to achieve your goal should be achievable. Okay? Although maybe at the beginning, students may be very eager to have their own research, and they are write big goals. It's good, of course, to think big and to have very impactful research, but at the same time, your objectives should be feasible, should be doable. You can achieve them. Okay, there is no point to say in your proposal that you are going to check a particular phenomenon in the entire Malaysia, while you don't have access to all the data related to this phenomenon in Malaysia. So first of all, you need to think about the way of achieving your goal. Otherwise, you will be in trouble. So that's why the proposal is quite important, and thinking about the how you will conduct your research is very crucial before you start. You shouldn't start any step of your research unless you have a very solid and detailed methodology that will assure you will achieve your goals. And also R stand for relevant, and sometimes they said realistic and also relevant. But here in this context is relevant. Relevant to what? Relevant to your introduction, context, the background, and relevant to your problem statements. It's not acceptable to mention in your problem statement, for example, about the adherence of the medications, like what the example, and then one of your objectives, you will add an objective, say, about the effectiveness of the treatment, unless you want to contribute this to the adherent, or about the prevalence of type 1 diabetes mellitus in this population. So it should be tally with your problem statement. Last one, T, it's time bound or timely. Of course, you need to have a very specific and detailed time frame, and you will have milestones. You will achieve one by one in order to achieve all your goals. Okay, saying, for example, you need a you will measure the satisfaction of the patients that attending your clinic. So first of all, you need to have a tool. So if you don't have a tool, if you don't have a questionnaire, you need to develop a questionnaire. So in this case, development of a questionnaire will be one of your objectives. So objective number one will be development of a questionnaire, development and of course validation of a questionnaire. This will be your first objective. With the first milestone, you will achieve your first goal, which is the development of the questionnaire. After that, you will use the questionnaire to check for the satisfaction of your patient. And then number three, for example, you will analyze the factor that associated with low or high satisfaction among your patient. So, for example, here we are talking about three objectives: development of a questionnaire, check the prevalence of dissatisfaction among your patient, and also find out the reason. I'd investigate about the factor associated with this. By each milestone, once you finish, you will achieve one of your goals. Okay, that's why it should be timely bound. And also you have to plan it very wisely, especially in the data collection. I'm talking about people, especially who will collect the data from patients, from people. This is different maybe from people whose research are lab-based. If you want to collect the data, you need to estimate the time needed to finish the data collection. If you are at master level, usually, generally speaking, your data collection shouldn't exceed 6 to 9 months maximum, because ideally you will graduate within 3 or 4 semesters. So based on that, your data collection shouldn't be more than half of your duration of your research. In PhD, maybe up to 3 semesters of data collection. But if it goes beyond this, so you may not graduate on time. So that's why you need to have a very detailed plan about the time to achieve your goals. Okay? What is the correlation now? The relationship between the objectives and the problem statement. We will start with the problem statement and then we will have our objectives. See, so number one, alignment is the key. Again, your research, your objectives should be tally with your objectives. Again, think about them about the roadmap. It's a plan, a guide, how to achieve your problem statement. But now you will have specific tasks to be achieved, to be completed in order to answer your research question at the beginning. So it should be in align with the problem statements. I already mentioned this one, objectives as a roadmap. So it's the detailed plan, your detailed plan, a stepping stones, how you can walk on these stepping stones until you achieve your or you finish your research. So this what is the task of the objectives. Refinement is always encouraged. All the time you need to revise and refine, revise and refine based on the progress of your research. There is no harm, of course, in changing of some of your objectives if you realize that this is not feasible, it's not doable, or there it needs some modification. So meanwhile, once you start the initial steps of during the initial steps of your research, you may change, but of course not totally change. Again, it's just kind of refinement to improve, revise based on the what you collect so far, the data, or what the information you have, what the feasibilities you have, logistic issue, materials, and all this needed to conduct your research. Okay. Um, I said maybe it's good to provide this or not, but I said it's good, I think, to highlight this issue. If you are familiar with how we write the objectives, usually we start with the letter to. So it's to evaluate, to explore, to identify, to check, etc. So based on that, is there any, sorry, is there any difference in is there any difference in this verb? Although they are used interchangeably, and you will find a list of objectives saying to assess, to evaluate, to investigate, to identify, to explore, to examine, all these with the same, almost the same meaning, but actually there are some differences. So I thought this may be good. This is from linguistic perspective mainly. Okay, so assess and evaluate. Although they most of the time they use interchangeably, and this is acceptable. However, some differentiate between these two. So you will assess something, which is whether this is the uh, um, any value has any value, like the average consume of the calories per day in Ramadan. So you will assess what is the average and evaluate. You can use the same verb, but some of them differentiate, saying that evaluate, you will assess it against a standard. So most likely we are talking about the effectiveness of an intervention, of medications, of new policy by the government, how this is effective. So when you say, so you will have a judgment. This is the main difference. You will have a judgment while when you use the verb evaluate. But you will assess, you will just assess and give numbers, okay? You are not saying whether this is good or bad, effective or not, but evaluate, you may give judgment. Again, it's acceptable to use them interchangeably. For the check or test, so you may have a fact, but you need to check. You need to test, okay, whether this is a valid tool, for example, that can be used to assess the satisfaction of this patient. So you have a tool, and but you are not sure whether this will be reliable in your population. That's why we have a cross-culture adaptation of questionnaire. So we need to check, we need to test about the reliability and validity of these tools to be used in this population. Investigate usually is a systemic inquiry, which usually delve in deep to find out a new information, like investigates about the factor that may be associated with this lack of adherence. Okay. Explore usually will be like your initial step. You will explore, for example, the potential of application of artificial intelligence in telemedicine, let's say. So what are the potential application? What are the potential solutions? So it's just an explore. You will try to explore the physician opinions about using video call for providing services to the patients. So you will explore. You will have an idea about this particular phenomenon. Identify, you will pinpoint the specific things, like identify well, what examples we have. identify the risk factor, for example, for cardiovascular disease. So I will have, by answering this objective, or you will have 1, 2, 3. I know now what is the reason, what is the cause of this phenomenon. Examine usually is more specific. You will examine whether your method, for you develop methods, for example, for analysis, chemical analysis, HPLC or whatever, you will examine. So you have standards, you have a tool, you will examine this one, and to see whether this is effective, successful, or not. You will see that people may mix this up, but at least I believe once you prepare your objectives, go and check for the use of this particular verb. Okay. Any questions so far? Okay.
Oh, no, bro.
All right.
Right. Thank you.
Any question? No. Okay. So now we will have some example for the objectives. I used actually the same problem statement. So how can we extract objectives from these problem statements we already stated in previous slides? The first one, which is the lack of access mental health services in rural communities in Malaysia that contribute to increase the mental health crisis like depression, anxiety, which reduce the productivity and increase the healthcare costs. Okay, you can see. Of course, based on that, you may have many objectives. Okay, it could be up to 10 objectives. It depends. But what you are going to cover, of course, it depends on your plan, on your overall overarching goal for your objectives, for your research, sorry. So objectives is they give you the specific information, roadmap about how to conduct your research. So let's see. This one, for example, to investigate. So when I use the verb investigate, because this is a systemic inquiry, so it will come up with a new information. They investigate the barriers faced by residents of rural community in Malaysia in accessing mental health services. Either, for example, the clinic are so far, so they cannot access because, or because they are afraid of the stigma if they go for mental health care services. So all these factors, all these barriers, now who we will ask, also it depends on your research. You can ask this from the patient perspective or from healthcare provider perspective also. Number two is to evaluate the impact. Okay, so again, usually evaluate, we will assess the effectiveness, the impact, the influence of something, of untreated depression and anxiety disorder on the social and economic well-being, including the effects on productivity and healthcare utilization pattern. How are you going to assess? This will be detailed in your methodology. It's not in your objectives. How are you going to assess the productivity? You will detail this one in your methodology. In your methodology, you will say, for example, how many days they will be absent because of this anxiety and depression. You will divide it, for example, by the total number of working days, and you will come out about, for example, productivity, percentage of the productivity. Same applied for the healthcare utilization, the cost, again, from the either from a health care facilities perspective or from the patient perspective. 3, to identify potential solutions. Here also you can use the verb to explore. potential solution to improve access to mental health services in rural community of Malaysia. So pay attention that here you are not going to implement solution. You are not going, for example, to provide a movable clinic, mental health clinic, and goes to rural area. So you are not going to provide solution, but you are try to find out solution based on what? Based on the opinions of the patient and also healthcare providers. So how you can answer these objectives? By listing the potential solution. Like, for example, one of them is movable clinic, for example, online services, mental health care services, because this is rural area. So all this will be listed, again, based on their opinion. Another one could be also to estimate or to assess the prevalence of depression and anxiety disorder among these residents. So usually this should come first, actually. So this should be the first one, in fact. First, you need to assess the prevalence to know. So you see here that the assess, you are not assess it against standard. So like evaluate is you need to see the impact, which this is the or the effectiveness, how this could affect another issue, which is here the productivity. But here the prevalence of depression or anxiety disorder among residents of rural community in Malaysia. So is it clear now how to extract? We will have one more example, which is the one related to the medication adherence among older adults who are on type 2 diabetes mellitus. Read these three to estimate or to assess the prevalence of treatment non-adherence among type 2 diabetes mellitus older adults in, so I here specify the area in Klang Valley, Malaysia, because I put in my problem statement in urban area. Okay, if I put, for example, in any kampong, so this is not tally with my problem statement because I said it's urban areas. So my area of research, the geographic area should include only urban areas. So that's why I put as an example in Klang Valley, Malaysia. Number two is to investigate. Again, investigate. Systemic inquiry will give you a new information. The factor influencing adherence to prescribed treatment regimen among older adults diagnosed with type 2 diabetes mellitus in this area, including social demographic variable, health literacy level, and access to health. Why I put this is in green? Because I believe that this is optional, whether you need to include in your objective or this should be only in your methodology. If you just put a full stop up after in Klang Valley, you didn't give example what are the factors you will assess, saying social demographic, health literacy, and access to healthcare services. This could be included in your methodology. You don't need to detailed in your objectives. Last one is to evaluate. Now we are talking about the effectiveness of current intervention, meaning we have current intervention to improve the adherence. We have many interventions. One of them, for example, smartphone application to help patient to be more adherent to their medications. Okay, we will assess the effectiveness. Or, for example, phone calls by the healthcare providers. Remind them about to be more adherent to the medications every day, every other day, etc. So we will assess the effectiveness. How we will assess this? This will be detailed in the methodology. We will assess, for example, the number of pills consumed over the number that must be consumed. So saying that this patient should consume 30 tablets every month. So he need to come for fill up every month. But if he comes after 40 days, so meaning they are not adherent. So the 30 days last for 40 days. So we will have this ratio 30/40, so or 40/30. So we will give us an idea about their adherence level. And also for the number one, to assess the prevalence of non-adherence. How we assess the adherence? We have tools, of course. If you are familiar with this, we have Morse scales, we have MyMats in Malaysia. We have a tool, we ask the patient some question and we have scores. And based on these scores, we'll divide the patient whether they are adherent or not adherent to their medications. Okay? Good? Okay. So last things, I believe that it's good to contrast the difference between, because maybe it's will be this blurred for the some of the students. What is the difference between all these terms? So we talk about the second two, problem statement and objectives. What about the research question? What about the research hypothesis? As I mentioned at the beginning, after literature review, you will come out with research question. So research question is a question you should answer by the end of your research. So what are the factors associated with medication non-adherence among older adults? Again, some of them divided into a general question and specific question. General question, we are talking about the for example, what is known about the medication non-adherence. So this is a general question. And we have three specific questions. Each question will be answered by objective. Each question will have another objective. Personally, I don't prefer, because it will be redundant for me just to state the same information, but you will put it in question way, research question. What are the factors associated with non-adherence? Objective is to investigate the factor associated with non-adherence. I believe this is redundant. So the research question, I believe it should be general. We are to what we are investigating. For the research hypothesis, it depends on your expectation, of course, based on either your observation, experience, and also literature review. If we think about saying a specific factor that can affect, for example, the patient adherence. Let's say we are talking about the cost. So we will compare two groups, which is the high income people and low income people. And we will assess, we will compare the adherence between these two groups. Usually, in research hypothesis, we have the null hypothesis and alternative hypothesis. The null hypothesis usually will assume that there is no difference. There is no difference in these two populations. There is no issue. There is no problem. Okay? There is no effect on the waiting time, on the patient's follow-up their treatment. So this is the null hypothesis. But the alternative hypothesis, which is the H1 or HA hypothesis, we assume that there is a difference, there is an impact to this factor on the patient. There are some outcomes associated with this factor, characteristics, whatever you are looking for. Problem statement already explained, and same applied for objectives. So I think that's all from my side. I try to cover the points that I believe they are important related to the problem statement and objectives. So I will just open the floor for any question. Any question related to this one?
Assalamu alaikum, Professor.
Alaikum salam wa rahmatullahi wa barakatuh.
My question is that you
Yeah.
can have hypothesis questions together with the objectives.
Okay. Okay.
That is
Sorry,
my question.
sorry, the line is interrupting. Can you come again?
Yeah, my questions, you can have research questions, hypothesis together with a specific objective in the same document.
Yes, yes, you have, of course, definitely. So it depends on the requirement actually on your faculty and your institution. Some of them may
Yeah.
request for this general and specific research questions. Some of them just ask for problem statement and only objectives. That's what we follow in my faculty.
Okay, thank you, Professor.
Okay, thank you, Brother Sultan. So, any other question, brothers, sisters? Okay, so if there is no question, we will have another session, inshallah, by 2:30, from 2:30 to 4:30. So please, I ask all of you to prepare just a very simple few slides, maybe 3 or 4 slides. So the first slides will be like a very short background about your research. The second one will be the problem statement. And the third one will be your objectives. So you will present and we'll try to have feedback from all of you. And I will comment, inshallah, if needed. So please use the information that's already provided in this class to well craft your problem statement and objectives. Okay?
Hello, Professor. Sorry
Yeah.
to interrupt.
Yeah.
This afternoon session,
Hmm.
will we upload the PowerPoint slide in here?
Okay.
I'm not familiar with this Teams Microsoft.
No, not to upload, sister. So if every students will present, will share the slide, we'll read and then we will comment.
Okay,
Okay?
okay, thank you.
You don't need to upload. Just prepare yourself and one by one, your turn, you can present and then we can comment. If we have time, of course, to cover all of you, this would be great. Otherwise, so we can just select few of you.
Okay, thank you.
Okay? Okay, thank you so much for all of you. And inshallah, see you afternoon.
Okay, thank you, Doctor.
Okay, assalamu alaikum warahmatullah.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, students, so the next class is at 2:30 p.m. Okay.